What is a dental bridge exactly, and how is it supported by the teeth that are adjacent to it?
So I talked about the crown being like a shell that sits over the top
There
of the
you go.
tooth.
Yeah, that.
So
Yes.
with the bridge, you've got two of those that sit on the adjacent teeth, and then it's bonded or it's stuck together with a porcelain tooth in the middle. So
Okay.
it's all bridged together. It's kind of like three teeth sitting on two, so that it looks and feels like you have a tooth there.
Oh,
So
okay.
it's a good solution for replacing teeth when something's missing, especially when an implant is not an option.
Welcome to Care Experts, a podcast dedicated to providing the inside scoop on health and self-care.
Make sure you join us each week for candid conversations with wellness and medical specialists.
Yes, real experts here to help you make the best choices for you and your loved ones.
I'm Melissa, a native Texan living in Atlanta.
And I'm Selah, a Californian through and through, and we're your co-hosts.
That's right. We're both proud moms here to have meaningful conversations with experts from all over the country who empower, inform, and inspire.
From cosmetic to dental and vet to vision, this is Care Experts.
I know we're a few years removed from the pandemic, but I cannot tell you the number of people I know personally who are like, I'm not going to the dentist during the pandemic because
Oh,
it'd be all up in my
yes.
face, all up in my mouth, you
They
know?
were
and then-
worried. Yeah,
they
that
were
makes
worried.
sense.
Yeah, and so I know a lot of people who were not going to their routine, regular dental exams. I know you're making that.
Crazy. I go twice
Yeah.
a year. I went through the
Oh, that's
pandemic.
good,
I'm like
good.
not messing around because I had a lot of cavities as a
Sure,
kid, so I don't want
sure.
anything to go wrong.
No, I totally get that. When I didn't go during the pandemic, I feel like that contributed to some of the extra work I've had to have done. Yeah,
That
I
makes
thought.
sense.
Well, I thought, okay, maybe I'll just brush my teeth a little bit more.
Yeah.
Maybe I'll just floss a little bit
the
harder.
flosser,
Whatever.
do the water flosser.
All
Yeah.
all the things, to prevent anything from going wrong. But I know how important it is to have those routine dental exams.
I know. Well, especially as you get older,
for sure.
that is very important.
For
but
sure.
also kids. Like we're both moms.
Oh my
It's
gosh,
so
yeah,
important. We started going when they were 1.
Oh wow.
Well, my kids had a lot of teeth
I was
early
gonna
on.
say, some babies come out with teeth.
Oh, I know. Mine didn't come out with
I was
teeth.
like,
no.
oh honey.
But I have seen that. It's crazy.
Yeah,
It's really weird.
Yeah, because I remember asking my son's pediatrician, like, how soon do I take him to the dentist? She's like, well, as soon as he starts having teeth.
Yeah.
I'm like, that seems really young. Like, really?
It's crazy. Well, and to get into that habit young with
For
them
sure.
going to the dentist, but also brushing their teeth, it's so important.
And taking the fear away.
Yes.
And not leaving that up to just the dentists themselves, but for you to also say, like, this is just like a regular thing we do. It's a checkup,
Yes.
It's
It's so important. There's so many things that linked to gum disease, bad teeth, like brain problems,
heart problems. Yeah, I've read that before. And
Crazy.
so it is so important to maintain a routine dental exam schedule. I think it's at least twice a year, right?
Yeah,
that
that's
you're
what I'm
supposed to go. But I guess we'll get that confirmed with our expert today, right? And
That's
today we're
right.
talking to Dr. Scott Harris, who has practiced as a cosmetic dentist for more than 17 years, but his career in dentistry goes back much further.
Yes, he attended Arizona State University for his undergraduate studies and received his doctorate from the University of the Pacific Dugonie School of Dentistry in San Francisco, California.
And Dr. Harris's desire for improving the confidence of his patients has become his passion. I love that. He is
too.
considered a key opinion leader for his knowledge in cosmetic bonding and porcelain veneers.
That's amazing. He is a founding member of the Elite Academy and lifetime qualified member of the Crown Council.
Wait, when they say Crown Council, they're not talking about the ones on your head, right?
But no, they're talking about this, the mouth. Yes, the
Like, if he
Crown
comes in here wearing a
Council.
crown, I'm gonna be like, wait a minute, Dr. Harris.
Should we call you King
I
instead
know,
of Doctor? Or do you prefer Prince?
Do I need to curtsy, Dr. Harris?
Yeah, there you go.
Do you make your
Exactly.
patients curtsy? Is that where the confidence building comes in?
Oh, there you go. Whose confidence are you building anyway?
Yeah. Now, let's get Dr. Harris in here to chat
Yes.
all about this.
Perfect. Hello, Dr. Scott Harris.
Welcome to Care Experts. So glad to have you here today.
Thank you for having me here.
Thanks for being here. Now, your career in dentistry goes back many generations.
Yes, it does.
Tell
yeah.
us about
Yeah.
that.
So my dad, I grew up going to my dad's office. I would help him with little things. I think he was mostly just trying to keep me busy, but
Yeah.
I would go there. I would pull charts for him. When I was a teenager, I would do things like sterilizing instruments, pouring up models. I was kind of like a lab technician. So I kind of did it all, and I grew up around it. And so that transition into dentistry and then cosmetic dentistry it was just like a natural progression. Yeah.
Right.
So you knew you wanted to because you already had the skill set.
Exactly. And you have 3 other brothers that are also in the dental world. Tell us about that.
Yeah. So I practiced with my partner and brother, Brian Harris. And then my oldest brother, Eric, is a dentist as well. I practiced with him for a while. He got in a motorcycle accident. Unfortunately, I had to take some time off. And so he's an instructor at the dental school now.
Oh.
And then my youngest brother is actually a dental lab technician. So he didn't stray too far from the field.
And what about, you have 2 sons. Are they also aspiring dentists?
They're thinking about it. Yeah.
Okay.
Yeah, they're thinking about it.
Cosmetic dentistry can certainly be very transformative for someone and boosting their confidence.
Yeah. I remember specifically this one time when my dad showed me this patient, college student, had a really small spaced out teeth, and she just did 4 veneers, and it was life-changing for her. It just made a huge difference in her confidence. Seeing her there, I was there at the office, and being able to see her smile was just beaming. And so seeing that transformation and that boost in people's confidence is what got me into dentistry.
That's so cool. It's so rewarding for you to see other people's lives change so much. That's
for sure.
amazing. Now, what about, have you experienced any dental problems or issues that you had to go through yourself? Have you ever?
So now you're going to make me tell my secrets?
Tell your
here we go.
stories, because your
So-
teeth are beautiful, by the way.
Oh, thank you.
I think they have to be.
I mean, right? No.
So most people think that dentists have perfect teeth and don't have any issues.
That's why I wanted to know. Like, have you ever had to?
I was one of those kids that grew up getting cavities all the time.
Me too.
Yeah. So, and I'm a grinder and clencher, so I've worn my teeth down. I've had a tooth break. I've had to have an implant placed. So I've kind of been through it all, which for me, it's a good thing because I know what patients are going through and I can tell them what to expect based on my own experience. So yeah, my teeth are not perfect. Many flaws.
They look
So-
like it.
Yeah,
from
they look
here. I'm
good.
just gonna say
I hope
so,
people
Dr.
watch this
Harris.
episode
Yeah,
too,
so they
because
can see that.
they could see him.
There's so much fear surrounding going to the dentist, going regularly, because you hear horror stories. One person had one bad experience, and then that just keeps passing on from one to the other. What do you say to people who are fearful of going to the dentist?
So I understand people's concern. When it comes to going to the doctor, I don't like going to the doctor. Like I just don't like it. But I understand people's concerns. I think the important thing for patients to know is that if you're seen more regularly, you're going to have less issues. You can put out fires when they're small. You can catch cavities when they're small rather than letting them turn into bigger things like root canals and crowns and implants. And so, that's the main thing. It's important for people to know that you may not like going, but if you do it, you're going to have less issues.
These routine dental appointments, how many a year do you recommend people? I go twice a year now.
Yeah.
Is that normal?
And that is normal.
Okay.
Yeah. Seeing the dentist and the hygienist every 6 months is normal.
Wow.
Some people that have bigger issues with gum disease or, get cavities a lot more frequently will often suggest that they are seen even more regularly every 4 months or so. Yeah.
Okay.
In addition to cavities, what else are you looking for during a routine dental exam?
So decay and then gum disease I call it the silent killer, just because it can create a lot of big issues before you know that it's going on. And so gum disease is something that we try to diagnose and treat early so that people don't end up having bigger issues.
Can it lead to like a heart attack? I've heard that gum
Yeah.
disease. Oh my goodness.
So there's a lot of studies that have shown that everything from Alzheimer's to heart issues is related to the bacteria found in the mouth. And so when you have a problem here, it can spread, and it doesn't necessarily cause issues, but it can exacerbate other medical problems and make things a lot worse.
Oh, okay.
So we're moms and we have littles right now. When should someone start taking their children to the dentist?
So when they have teeth,
See, I knew
That's
you.
where we
That's
start.
what his
Yeah.
pediatrician said.
Yeah.
Okay.
Yeah,
Okay.
when they have teeth. And, we'll start them out nice and slow. We call it a happy visit. So, we'll go and just kind of brush their teeth and give them a little prize. And when you when kids start seeing the dentist early, they're less likely to have that fear and anxiety
Yes.
when it comes to going to the dentist.
That makes sense. My kids actually love going to the dentist because they get the TV, they get screen time, they get a little toothbrush, a prize, they love
Stickers.
it. Yeah, stickers. They have a little playroom there.
Do you give stickers for adults too,
Yeah.
Dr. Harris?
We've talked about that, doing like
Oh,
a little
really?
adult treasure chest at
I
the
mean,
end.
why not?
My
Yeah.
dentist gives us chocolates after, and I'm like, wait, isn't this
Wait
not
a minute.
what we
That
should be
seems
having?
counterintuitive, or perhaps a trick.
Yeah,
Oh,
there you
they want
go.
more business.
I better take a note of that.
Don't you do it, Dr. Harris.
That is so true.
So if I am fearful of the dentist, but I've decided I'm going to start having my routine appointments because I want preventative care, walk me through what that routine appointment looks like.
So the important things for a routine visit are getting x-rays to diagnose the gums in the teeth. Cavities on the outside of the tooth, like the top and side of the teeth, they're visible to the dentist, but the cavities that are in between the teeth, the ones that can really cause a lot of damage, are often hidden. So we want to get x-rays to see where things are with the bone and with decay. Seeing a hygienist regularly for a cleaning is important. We pair those two up with the exam and the hygienist so that you're not having to come back for multiple visits. And so getting an exam, having the hygienist measure your gums so we can identify areas of inflammation. Doing those things allows us to find things early and treat things more conservatively.
Yeah. What about a deep cleaning? Is that necessary every year, or how? I've heard of this once a year deep cleaning.
Yeah, so typically deep cleanings, we have to do a deep cleaning when the tartar buildup on the teeth becomes more
Really bad.
involved. Yeah, it gets
Okay.
below the gums, and that tartar buildup is what leads to periodontal disease. And so if their dentist starts seeing a lot of buildup below the gums, that's when they'll recommend doing a deeper cleaning.
God.
So there's no set time. Yeah.
With the deeper cleaning, do you have to be numbed for that?
A lot of times they will
Okay.
numb you, but there's new products out there, new topical anesthetics to where you don't have to get the shot. Everybody wants to avoid the shot, but there's some excellent products out there that allow you to numb the gums and clean things more comfortably without getting shots everywhere in your mouth.
Good.
I've never felt that the topical treatment works. I'm just going to be
Yeah,
honest. I mean, maybe there's a brand new one that just came out yesterday, but I don't know if you can see it from where you're sitting, but I've had a lot of dental work
Yeah.
done. I've had a deep cleaning. I had one this year, and I had 22 shots
Oh,
in my mouth. Yeah, I counted. Yeah, and that was not fun at all, but don't they look pretty?
They
Yeah,
do.
they do.
look
Yeah,
gorgeous.
so-
yes, they
Got a beautiful
do.
smile.
I appreciate that. I also
Yes.
had 4 crowns recently at the same time. That was fun. Yeah, we were talking about like when you're pregnant and how your teeth kind of change, your gums can change. And these are things you can't even anticipate, right? Are there certain things that you do differently for women who are pregnant when they come in for their routine exams?
Yeah, so I always default to the OB. So I like the open communication with the patient's doctor, just so we know what specific needs they have. So typically things like cleanings we can do without any issues. But if the patient has to get numb or if they need certain medications, that's something that I'll always defer to the OB. We always want to make sure that, we're following their guidelines.
Right.
How often do genetics factor into someone's overall health or oral health?
That's why. Well, because we were talking about both of us as kids having so many cavities, and half of my one of my sons had 2 cavities already. He's 3, and one did not. And then same with my siblings, half had cavities, half did not. Is it a genetic thing? And I really took care of my teeth as a kid, and my
She's
kids
like, don't
too.
scold me, Dr. Harris. I
We went to the
promise. I
dentist.
promise
Yeah.
I've been taking care of it.
Exactly.
So we're learning more and more that some things are genetic and some things are passed by saliva. For example, like, people that are real prone to getting cavities, that type of bacteria is often passed from the mother or father to the child, just from sharing drinks or
I've
things
heard
like that.
this.
Yeah.
And then you're passing on your bacteria, and then they're going to get this. That's crazy.
Yeah.
Oh my God.
And it's hard to avoid, you kiss your kids or you share drinks or their pacifier drops and you like,
Lick it.
you're
Done
trying
that
to like
before.
clean it up. But it's hard to avoid, but that's how things happen. Kids aren't born with the type of bacteria that cause cavities. That's something that's passed.
Okay.
I
it's
didn't know
passed.
that.
What about some teeth more porous than others as far as enamel goes? Or
Yeah, so people used to think that it was a porosity thing. Some teeth are more porous, and some are, and especially if people have enamel issues, deformities in their enamel. But what we've also found is that the type of bacteria, the ratios of certain kinds of bacteria play a bigger role in whether somebody gets cavities or not. So everybody has bacteria. Some people just have higher amounts of the cavity causing bacteria.
Okay.
And when that's the case, they get cavities easier.
so it's not flossing or like I worried about my 3-year-old. It's how can you floss a 3-year-old's teeth?
Good luck.
I know.
And flossing helps. We do everything that we can to keep things clean. But yeah, some people, like when I was a kid, I did all the right things. My dad was my dentist, but I would still get cavities a lot. I had a sweet tooth, but
that too. Yes.
But I was just very prone to getting cavities.
Oh man.
Okay, so then let's talk about that. You're saying even as a kid, you had good dental hygiene, even though you liked your sweets. I like my sweets now too, right?
Yeah.
But what are the habits that we should be forming in our kids and then also maintaining in adulthood to maintain good oral hygiene?
At home specifically, right?
Yeah.
So I tried to make things fun for my kids. I would say things like, if you brush and floss, then you get the special purple rinse, and I don't remember if it was like Ninja Turtles or something. It had something on the label.
Something exciting, for them.
And so I made it sound kind of like a treat. And so they'd get the fluoride rinse, and I would sit there when they were old enough. I'd make sure that they'd rinse with it and spit it out. And but yeah, just trying to make things fun. When you force things, then that's when it becomes a little bit difficult. I've had patients where they've bought the little flossers that have little cartoon characters on it.
We
I
have
haven't
those.
seen those.
Anything you
Those are
can do to
cute.
make it more fun
Yeah.
will help them to develop those healthy habits.
Okay.
But brushing in the morning first thing, brushing before they go to bed, of course.
2 minutes each time.
Yep.
Okay.
Oh, setting a timer.
Setting a timer.
Yeah.
We have one of the toothbrushes that I bought for my son came with, it was like a whole kit, and it came with one of those hourglass things.
Yes.
He really loves
Loves
that. Yeah, he
that.
loves it. He's like looking at it the whole time while he's brushing his teeth.
It's so funny. I was just thinking I need to get that because I loved that as a kid.
I don't know where I got it.
I remember that. Oh, I'm sure Amazon has.
I mean, they have
sand timer.
everything. They
Yeah,
have
just
everything.
because I loved that.
So during a routine dental exam, let's say you find a cavity. That means somebody's probably going to need a filling or more. What is a dental filling?
So essentially what we're doing with the dental filling is removing the decay that's there. We don't want it to spread out anymore. And then I only do composite fillings, bonded fillings. I don't do the metal ones anymore.
I have a mouthful.
Never have, not since dental school when I was required to. But so we're basically removing the bad part of the enamel or the dentin and replacing it with a bonded filling that replaces that area and helps to seal that spot off so that decay doesn't continue to spread in that area.
Dr. Harris, I mentioned that I've had several crowns, and I know just from my own personal experience that, a crown means it's beyond the point of just being able to get a filling. But I don't actually know what a crown is. I know they're not putting a crown on my head when I leave. Nobody is going to curtsy.
This is a crown you don't
so
want.
what is, no, it is not a crown that you want, but sometimes it's necessary. What is a dental crown?
So when a crown is necessary, it's because the outer shell of your tooth, the enamel, is broken down to the point of where you can't do a filling to fix it. When it's a small area, you put a filling in and the outer tooth structure helps to support it and keeps things durable and strong. When the outer enamel starts to break down, sometimes you have to do a crown that is essentially replacing the outer enamel shell of your tooth. So they do grind some down around the, off the top and sides of your tooth, and then they're putting a porcelain crown or cap over the top of it, kind of like a helmet sits on a head. They bond it in place, and it's there to help prevent your tooth from cracking or breaking down to the point of not being fixable anymore.
You explained that so well.
Yeah,
I'm like, oh, now I
very-
get it.
Yes.
I never asked my dentist because I just want to get in and
Just
out
get-
as quickly
yeah,
as possible.
don't tell me.
Don't tell me. I don't want to know the details.
Exactly.
Now I do.
Now I do.
So that everybody who's listening can know the details too.
Exactly.
That's why our expert is here.
It's helpful.
It is really helpful to be informed.
And you talked about it, I do as well. I grind my teeth. I wear a guard now at night.
Yeah.
Does that also lead to, what does that lead to? I should ask.
So you're going to get chips. The edges of your teeth are going to wear down over time, which down the road can lead to bigger problems with, the teeth breaking. With me, that was the case. I wore my teeth, but then I was grinding and clenching and ended up cracking a tooth in half. And so there's a lot that can happen when you're grinding your teeth at night. And the amount of force that you put on those teeth at night is significantly higher than what you can put on them during the day. And so a lot of that breakdown and wear does happen at night.
Ooh, and is that why you need like a dental bridge? Is that where those come in?
So a dental bridge can help to replace missing teeth. For helping to prevent wear. Night guards, you can get like a retainer or night guard to wear at night that helps to preserve the teeth so you're not grinding them down.
Right.
But yeah, when you get in a position where you end up losing a tooth, a bridge is an option to then replace that.
Okay.
How is a dental bridge? Because I'm picturing a bridge
Me
in
too.
my head. But like, what is it? Because you gave such a good analogy before when it came to the crown, like it's like a helmet
Like a
setting on
helmet,
your head.
yeah.
What is a dental bridge exactly, and how is it supported by the teeth that are adjacent to it?
So I talked about the crown being like a shell that sits over the top
There
of the
you go.
tooth.
Yeah, that.
So
Yes.
with the bridge, you've got two of those that sit on the adjacent teeth, and then it's bonded or it's stuck together with a porcelain tooth in the middle. So
Okay.
it's all bridged together. It's kind of like three teeth sitting on two, so that it looks and feels like you have a tooth there.
Oh,
So
okay.
it's a good solution for replacing teeth when something's missing, especially when an implant is not an option.
Why wouldn't an implant be an option?
So with an implant, you need good bone quality, and when a tooth has been missing for a really long time, or there was a massive infection that wiped out the bone, sometimes that bone can be repaired and grafted, but sometimes it can't. And when it can't, then we do a bridge to make it look like there's a tooth there.
Oh, wow. Okay.
Here's something else we have to talk about that I've had one or two or three or more of these as well. Root canal.
Oh, I've never
it
had
just
one.
Sounds bad. You
I'm
don't
so
want one.
scared of them.
You should be. It's awful. Yeah,
is
don't.
it?
Well, look, I'm sure if you go to the right dental professional, it can be less awful. But
It's
Dr.
nothing-
Harris,
no
it's
walk
nothing
in the
you
park.
want.
Yeah,
No,
nothing you
not
want.
even a little bit. What is a root canal, Dr. Harris?
Nobody wants to have a root canal. But, so a root canal is when the decay on the inner surface of the tooth gets to the nerve, and the inside, the roots of your tooth become infected. So every tooth has a hollow channel that has blood vessels and nerves in it. And so when the decay gets into that and it creates an infection in there, the only way to take care of that infection is to get in there, you go through an opening in the top of the tooth, and you clean everything out, kind of sterilize the inside of it, and then you seal it off to help prevent infection from coming back.
Oh, that sounds so painful.
So
It's not pleasant. I'll tell you that.
You've had
No.
several?
I have had several. My first one was in college, I think, or after college. I'm going to be completely honest here. I was not doing who is during
In
college?
college,
Yeah, I was not. I wasn't keeping up with my routine dental appointments as I should have been. And I certainly am
Right.
now.
Oh, man. Wow. Let's also talk about teeth whitening. Do you do that in your office as well? Okay.
there are different options for teeth whitening. The most popular one in our office involves the light, and you put the bleach on the teeth. It requires a little more time. The dental assistant has to assist with that, and they want to block out the gums so you're not irritating the gums, but you're going to get a much more dramatic, immediate result doing a professional teeth whitening like
In
that.
the office.
Yeah.
How long does that take in the office?
It's usually about an hour and a half to 2
Okay.
hours, kind of depending
you're
on
one
the
and done?
process. You're one and done.
like
We
that.
do offer some custom trays along with that, so the patient can touch up over time and continue to get brighter. But yeah, it's your teeth are gonna see you're gonna see a much more dramatic, immediate change with the shade of your teeth.
Are there any negative side effects associated with teeth whitening?
So most people are gonna have some sensitivity. Some people more than others, but with whitening, that goes away after 24 hours.
Oh,
So
that's good news.
I always tell patients, expect to be sensitive, take ibuprofen, use a sensitivity toothpaste for a couple weeks beforehand. But then just expect it, 24 hours, it's going to be sensitive, and then
But it's
gonna
not
get better.
hurting your teeth or anything like that. Like, because I heard that it used to decay the teeth or chip away at the enamel to do too much whitening. Is that true?
Yeah. So the products that are available now, they don't create long-term damage to the tooth.
great.
It's the temporary sensitivity, and then it goes away. I've never had a patient have issues with teeth breaking down or anything like that
Oh,
from
that's
whitening.
great news.
And when you speak to sensitivity, are you referring to sensitivity to cold and hot temperature changes or just overall sensitivity based on having had the procedure done?
Yeah, so the cold and hot, those things are going to irritate the teeth the most. But some people just sitting there will kind of get a random zing in their tooth. And so, yeah, like I said, some people have a stronger response than others. And when it's bad,
Yeah.
like mine, it's bad for me.
Really?
Yeah, so I'll just be sitting there and it's, get this little zing. Yeah,
That's funny.
I plan ahead, know that it's going to be sensitive, try not to eat cold things. And
Yeah.
I just know that I'm taking a little bit of pain to have my teeth look better. So
They still look really good from
Yeah,
over
they
here, I'm
do.
just saying.
Yeah.
We were talking about during the routine exam, that involves a dental hygienist and the dentist as well. What is a dental hygienist and what is their role during a routine exam?
So a dental hygienist has gone to dental hygiene school to learn how to treat gum issues, periodontal disease, things like that. So they work in conjunction with us. Typically, the doctor is diagnosing the problem, but my hygienists are great. A lot of times I'll walk in, they'll give me their opinion, and I look and it's spot on to what I see. But yeah, the hygienist is there to help clean the teeth, help get the tartar and the buildup off of the teeth that causes gum disease. And they play a pretty critical role in my practice for helping people maintain their dental health.
Yeah, I love my hygienist.
Yeah, they're great.
You've told us all about the importance of having these routine dental exams at least twice a year. As I mentioned earlier, there's a lot of phobia surrounding going to the dentist. What tips would you give to someone who has that phobia?
So do anything that you can to make yourself comfortable. So wear comfortable shoes, comfortable clothes. We keep my office kind of cold, so we have blankets, weighted blankets. We have headphones, but do everything that you can to keep yourself comfortable. There's no point in hearing all the noises and stuff if you can be listening to your favorite music or a podcast. So do what you can to keep yourself comfortable.
Okay. What about sedation options?
For patients that have a little more fear and anxiety that need a little bit more help, laughing gas, nitrous oxide is a good solution. Oral conscious sedation, where you're basically taking a pill an hour before you come, helps. You do need a ride to and from. We don't want any issues with driving, but
Yeah.
That's a great solution as well for people that have higher anxiety. That's often what we suggest. And then for people that have are kind of beyond that and struggle even getting into the door, we do offer like IV sedation as well as a solution, just to kind of help things be more comfortable.
Right.
How important is it for a patient to communicate to their dentist and other dental professionals in the office about their fears of coming to the dentist?
It's important for me because I know that if you have issues, I can help with those issues. If you have a fear or anxiety, I can help with that. So let us know, and we can help suggest what we feel is going to be a good solution for helping you get through the appointment more comfortably.
That's great.
How do you help them?
Well, people, I think I got it from my dad. People would always say, I love Dr. Joe because he's so nice and gentle and he's so kind. And he was my mentor, and I've always tried to take that same approach. If I come in hot and flustered and in a rush, it's going to help. It's going to make people more anxious, and it's going to be harder for them to get through the appointment. I always try to treat people nicely, do things gently, keep them as comfortable as possible, and then just kind of assess their body language and see how they're really doing, and offer options for keeping them more comfortable.
You did a great job answering our questions, Dr. Harris, and making me feel comfortable. Selah, you too, I'm sure. Well, now we have one of our favorite segments. It's called Ask the Expert. This is where people who listen and watch the show get to submit questions anonymously, and we ask you, our experts. So here we go. Here's the first one. How often should I get a dental cleaning and exam if I have generally good oral health?
So cleanings every 6 months. And exams sometimes with patients that have very few problems, low cavity risk. Sometimes we'll bump them out to once a year, but as long as they're seeing the hygienist regularly where things can be monitored. So usually 6 months for both of those things, but sometimes we'll push things out to a year for those exams for patients that have really good hygiene and few issues.
Okay. All right, this person asks, what's the best way to whiten my teeth and how can I maintain the results?
So with whitening, there are a lot of solutions out there. Anything from like over-the-counter strips that you can use to the in-office, more involved whitening products. Whatever works with your budget, you're going to get decent results either way. The strips that you buy over the counter are probably just going to take a little bit longer. You might have to buy a few boxes of them to get kind of the same result. People that are looking for a little bit more of a dramatic, immediate result, the in-office products are going to get you there faster.
I'm so glad you brought up the budget because dental work can be very expensive. At your office, what kind of options do you offer for your patients to be able to afford the dental work they need?
So CareCredit is our number one go-to.
The CareCredit credit card.
CareCredit credit card. Yeah. So everybody has some kind of budget, and some people's budgets are higher than others. And so we always try to keep that in mind when we're diagnosing and treatment planning patients' care. When they have problems, we want them to be able to treat them and before they turn into something bigger and more expensive. And so just offering patients options has been really helpful. And the CareCredit credit card has been a huge help to our patients, being able to allow them to get the work done, but spread out the payments a little bit. And makes things a little more affordable.
Absolutely.
Okay, this person wants to know, are dental x-rays safe and how often do I really need them? You know what, that's my question too, because sometimes it's like, no, wait a minute. Y'all just took x-rays of my entire mouth the last time I was here. Do I really need these?
And I did worry about the safety, the
for
radiation
sure.
thing.
Absolutely.
So the radiation, the issues with radiation, things have changed a lot over the last 10, 15 years. So you're going to get significantly more radiation jumping on a flight, going somewhere. The radiation that's involved with dental x-rays has decreased significantly. So yes, nobody wants to take unnecessary x-rays, but when you take them now, you can take them knowing that at least there's less radiation than what you think there is. As far as how often they're needed, that does depend on the patient's issues that they've had in the past. So people that get cavities more frequently, I'm going to take x-rays more frequently, probably every 6 months. People that don't have issues will usually spread it out, do that maybe once a year, every 18 months. But I always will look at the patient's history and kind of determine what's needed based on that. And we try to switch it up a little bit. We try not to overload patients. We'll get the front teeth in one visit, and then the next visit we'll get the back teeth, just so we're not taking a whole big load of them all at once.
Okay, that makes sense. And this person asks, I have a really bad gag reflex. Ugh. Are there any tips or techniques for making dental visits more comfortable?
So talk to your dentist about this. If you're having issues with gagging, talk to your dentist. There are different solutions. They have products that the patient can swish with to help with the gag reflex. And then, anything that you can do to distract yourself during the appointment is going to be helpful with that. So something as simple as music, or I've had patients that have kind of lifted their leg up a little bit. I've had patients that have, squeezed a stress ball, but any kind of stimulus that distracts your brain from what's going on here, it can help with that.
Well, that's good to know. This person says, how do I know if I need a deep cleaning versus a regular cleaning? And what are the signs of gum disease to watch out for? I remember you talking about it being a silent thing too. It could be.
Silent.
Yeah.
So what you want to look for in your gums is inflammation, anything that's real red and puffy. You want your gums to be nice and pink and tight against the tooth. If something's kind of red and bulbous and puffy, that's not a good sign. Sometimes you can't see the stuff that's below the gums, but often when there's a lot of inflammation, there's tartar buildup, kind of calcified plaque below the gums that are causing that issue. And when that's the case, that's when people are going to need a deeper cleaning. When that buildup down below the gums is creating an irritation that you can't get off just with polishing the teeth, you're going to want to clean things a little bit deeper to get that off.
Okay, that makes sense. I have several treatments needed to calm my nerves. Can I be put under and get all things done at once? That's a good question.
Yes.
It depends.
Yes.
Oh, you said yes? Oh, okay, go ahead.
So you want to find a dentist that has experience with IV sedation or oral conscious sedation if you're going to do something like that. So, if there's a lot going on, sometimes we'll divide it up into a couple of appointments. But I've done full mouth rehabilitations to where they're coming in getting a full mouth of crowns, basically top and bottom. They get the temporaries the first visit, and then they come back for a second visit for the final. So we can do a lot in one visit, but do what's comfortable for you.
Yeah, he's got to recover from that.
Yeah.
Depends on your tolerance for pain as
there you
well,
go.
don't I know? This person says, is it true that using mouth tape while you sleep is beneficial to dental health, breathing, and shaping my jawline?
Wow, I don't even know what mouth tape is.
You tape it closed.
Oh, wow.
All the rage on social media for a while. That's the only reason I know
I
about
did
it.
not
I
know
don't
that.
do it. But
I got to go to TikTok.
So I don't know about the jawline thing. I want to look into that.
Okay.
But with the health of your teeth, some people are mouth breathers, and so when they're
I am.
So when you're sleeping at night, you're breathing through your mouth and drying things out. It does make you a little bit more prone to developing decay. So yes, mouth taping can help with that. And there are a lot of studies that show that taping your mouth at night does help to reduce snoring, or does help people to breathe more consistently.
Wow.
Yeah.
I feel like I would be afraid. Like I would wake up and be like in a panic with my mouth totally taped, That seems a little, maybe I'll try it. Does it help with grinding, by the way? Taping your mouth like that?
I don't think so.
Okay.
I've tried taping, and I still
Still grind.
still
know.
needed my guard.
My guard has like little holes in it now.
Yeah.
That's how much I grind. I know.
might be time for a new
Stress.
guard, Selah.
Yeah, I think so. Exactly. I got to get that.
Dr. Harris, thank you so much, because
Yes.
I know so many people out there who needed to hear about when they should be going, keeping these regular appointments. It is so important. Thank you for telling us all the things that are available to ease our fears. We really appreciate you
And
joining
you're
us.
Such a great energy. I'm sure, like you
know.
said, people are not afraid to go to you because you're so
Thank you.
gentle.
Now everybody's got to fly to Arizona.
Exactly. Now we got to do that.
Thanks, Dr. Harris.
Thank you.
Of course, thank you.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.